The American Chiropractic Association estimates that annually chiropractors see approximately 35 million children and adults. Also, Georgetown University reports approximately 16 million adults, or 8% of the adult population, experiences chronic or consistent back pain, which limits certain aspects of their lives. The university also says that back pain is the sixth most costly condition in the United States. Dr. Michael DeCubellis is a leading expert in treating chronic and complex injury cases. He has multiple clinics and currently practices in Downers Grove. And he helps others understand the why and how behind injury healing. He also works with other personal injury lawyers and doctors to train and implement the strategies needed to provide proper case management and injury treatment with specific systems. His entire focus is to treat the problem and not the symptom. Dr. DeCubellis joined me this week to talk about proper pain management, the importance of taking ownership of your own health, and so much more. I'm Kevin McShann. Let's have this conversation. So, Mike, if you're ready, I'll take a moment to welcome you to the program. And I'm super excited to talk to you this afternoon all about your work with chronic injuries, my friend. Great to be with you this afternoon. And thank you so very much for being here.
Thank you for having me.
So, yeah, absolutely. Now, Mike, I know that your day job allows you to help a lot of people with their chronic injury concerns. So I'm wondering if you can tell me about all the great work that you do.
Yeah, the biggest thing when it comes to especially chronic injuries and issues is first figuring out exactly what the cause is. A lot of times people, when they have gone to doctors or sought other treatment, the problem is it's a lot of symptom chasing. And when we chase symptoms, we're not able to get to the root underlying issue. And then we never really get any kind of major improvement. And the problem with that too is that after a certain time, things can become permanent. So we want to make sure we get to the root cause and then get that to try to heal as best as possible. That way we get the best kind of outcome measures. So it really starts with doing an in-depth kind of consultation exam, making sure we know everything that's going on, and then kind of putting the pieces of the puzzle together from there.
Absolutely. And Mike, I'm fascinated to know where your passion for this individual work comes from and why you're so passionate about the work that you do.
You know, it really came from starting out working with patients. I was noticing that there was a lot of people who were coming in for things that happened 6 months ago, 2 years ago, 5 years ago, 10 years ago, and we're still having similar complaints in those areas. So I wanted to figure out what was going on. So I kind of embarked on a journey of really trying to better myself and make myself a better doctor for the patients. So put hundreds and hundreds of postdoctoral training hours into this, and got my hospital qualification, trauma qualification, evaluation management qualification, primary spine care qualification. I'm going for my fellowship in primary spine care right now and MRI qualified. So making sure that I have just the best kind of knowledge to be able to help the people. And it's really been interesting that along this journey, being able to just have the resources and just increase my knowledge base has been able to get better diagnoses for patients. And when we understand how things fit together, we're able to get better results and outcome measures too. So it's really been just trying to do better by my patients, help as many people out as I can, but by doing it based in the actual research of what's actually going on and how the body heals.
Yeah, absolutely. And I know one of your major goals is to empower the patients that you work with to make more informed decisions. So talk to me about the importance of really empowering your patients with the information that they need to make appropriate decisions. Tell me about how important that is to you.
Yeah, it's really important. I'm really big on making sure that everyone understands what's going on, why we're doing things, why I recommend not only maybe a treatment, but recommend them to do something or not do something at home. Because again, the goal is that we want to get better results. So if they can understand what's going on, it really makes it a lot easier for them to not repeat past mistakes, but also to kind of understand or realize if something happens in the future, hey, this is what's going on. I understand this is the process. And it really just kind of helps that way. So, we'll do lots of different things. I'm always big on making sure that I sit down with the patients, answer any questions they have, explain things in a way they can understand. But we even put on workshops and trying to really kind of educate people so they understand what's going on. And then they can also see the warning signs as well.
Yeah, absolutely. And Mike, I'm curious to ask you if you have sort of a motto that you live by, both medically and in your personal life, that sort of guides your passion in the work that you do.
Yeah, I mean, really in practice, our practice motto is that we treat the problems, not the symptoms. This way we can actually get better results and better outcome measures. And then we can actually track everything too. Biggest thing too that I always tell people as well with everything is listen to your body. If something's hurting or if you have a symptom, that's your body's way of telling you that something's not right. So you need to listen to that. Don't try to power through it. Don't try to put it out. Because the longer it's there, the more you power through, the more risk you have for further injury or making it even worse. So really it's that, let's work on treating the actual issue, not just chasing symptoms, but listen to your body along the way because it's telling you where the problem is and what you need to avoid.
Yeah, absolutely. Now, Mike, I'm going to share just a little bit about myself. So I was born with spastic quadriplegia cerebral palsy, so it's really important for me to remain active and healthy. And one of the tenets that I live my life by is something that I always tell myself to be always active. So I try to commit myself to at least 10 minutes a day to active exercise. So tell me the importance of being active and the importance of that to minimize chronic injury as well.
Yeah, being active is really important. When we're doing that, it means that we're utilizing all our muscles, tendons, and joints the way that they properly should be utilized. And the problem becomes is that when we're not active or when we're in certain positions, our body starts to kind of change the way it moves. We change our muscle memory, and we can develop things like scar tissue and muscles, those knots that you feel. We can actually get more nerve fibers that form in areas and get wrapped around those scar tissue, which is trigger points. So it changes the way our actual physiologically our body is set up when we're not having that movement. It's really important to do that, and that's why even we've seen in medical science what they started doing is like after someone has a knee replacement, they don't want the knee to just be locked up and stay there. They put them on a machine that actually will have it bend and bend and bend because they know that movement is so important to proper healing. So if they're doing that after surgery, we should all be moving just throughout our normal daily life, not just sitting in one place. We've got to be active.
Yeah, absolutely. And Mike, I know that you also provide some expertise to injury law professionals. So I'm fascinated to ask you about that part of your work and the importance of sort of being diversified in what you can offer in terms of information to those professionals as well.
Yeah, so I do a lot of work with attorneys, help them in a couple different ways. First thing is that there's just so much that's going on in the legal community, just with new cases that are developed, but at the same time, there's a ton of new medical research that's coming out. So I like to let them kind of keep them up to date on what's going on in new medical research findings that can potentially help them out with a case that they have. But I also help them. I do case reviews. Biggest thing that I find is that there's sometimes either maybe a test wasn't ordered or it was ordered at the wrong time, something might have been missed, or it just might not be a great case because there isn't that much of an injury there to warrant the whole process of going to trial. So I'll work with attorneys, kind of tell them what I'm seeing, where they need to go. We do treatments as well, but this way I can help attorneys that even aren't necessarily having clients in our area, bring them value and just help them be better and more, just be better at their job and get better use of their time. So that way, if there's a case that isn't valid, they know it right away and they're not wasting theirs or their client's time. But also if it is something and a doctor just didn't order something or they haven't been getting treatment, we can get them in the right direction. So again, this way it doesn't end up hurting the client in the long run. So it's really about just trying to be an asset to the attorneys. And I have a large network of other doctors we work with too, so I can help them with a referral if we need be, because I can't help everyone with everything. And I think that's the way every doctor should look at it. You have a specialized area, but I don't step outside my specialty. So we work with neurologists, orthopedic surgeons, physiatrists, primary care doctors, emergency departments, urgent cares. We work with all these different places, and I have it to where we can get them in with referrals, and it's not waiting 4 or 5 months. It's within a week or two, which is really helpful too for not only for the attorney but for the client as well.
Yeah, absolutely. And Mark, you talk about when you talk about treating the problem rather than the symptom. Sometimes it's important to also, as you said, listen to your body and not make sure that whatever issue that you're dealing with sort of compounds itself by waiting to treat it. So I'm curious about your perspective on when you work with people that sort of have put issues off and how important it might be to sort of listen to your body when you first experience a problem, because the longer you wait for to treat something, the worse it gets, right? So I'm wondering your thoughts on taking ownership of your own health and what that means to you.
Yeah, I mean, it's really important. And one of the biggest things is that we know that everything in the body is interconnected. So if someone has, let's say they hurt their lower back, the problem and the issue, if not resolved, is not just going to stay in their low back. We have compensating mechanisms that go on, gating mechanisms. The body will change and alter to try to take pressure off of that area. So they might develop a neck issue later on in a couple months or a couple years. They might develop a hip issue. They could develop a shoulder issue just because of the abnormal movement patterns and biomechanics that their body is now put them in to take care of whatever the original issue is. So that's why it's so important to really kind of break down and see someone's pain might be in one area, but the problem might be in a different area. But that's where they're experiencing the symptoms based on how the body's responding to what the underlying issue is. So that's why it's so important to really kind of look at that. But taking ownership is 100% what has to be done, because doctors can only do so much. If we say, hey, we found this and this is what has to be done and this is what you need to do, there's things you might have to do at home. There's things you might have to change for a little while. And then, you got to go in and get treated. It's always easier the sooner rather than if you wait till later. Because the longer you wait, the more that has to be done to retrain or untrain biomechanics and muscle memory, and more damage that's being done that needs to heal. So the quicker you get in and get treated and take ownership of it yourself, the better results you're going to end up getting.
Yeah, absolutely. I'm also curious to ask you about the effects of what COVID did to the work that you do, and how that affected your patients and sort of their overall quality of life.
Yeah, COVID was really interesting because the one of the biggest effects that I found that I think people really didn't understand, and now we're starting to get to understand it. The first thing that happened is a lot of people were working from home. Now that sounds great in your mind, but the problem is that homes were not set up for office work. So now we're sitting on working on a laptop on a kitchen counter, not the right height, doesn't have proper back support, or on our couch working on that. So it's okay when you're doing it for 20, 30 minutes, but now when you're doing that for 6 to 8 hours a day, that abnormal posture creates problems and stress over joints and muscle and tendon fibers. So now we created issues where there were no issues before, or we took something that was very minor, and then when you overstress the body with this abnormal position, now we created things. The other thing that happened too is that a lot of people decided that they wanted to try to get more active, and they had not been very active before, and instead of easing into it, they kind of overdid it and did too much. So we had quite a bit of injuries that happened there. And then the third thing that's really interesting, and I was talking to a couple of attorneys about this, especially when COVID first happened. What we found is that when people were in like auto accidents, they were less likely to actually go and get treated or go to an emergency room because they were so worried about COVID. So the injuries or their pain had to be so much higher than what we were typically seeing for them to actually go in because they were so worried about COVID. So there was an interesting kind of length of time to where people who were injured weren't seeking treatment, and then they were at a later date, which obviously throws a wrench into things. But those three things were just kind of the really interesting phenomenon we saw during COVID.
Yeah, absolutely. And Mike, I'm also curious to ask you about sort of alignment versus, I always say that in life we make time for the stuff that is priority in our life. So I'm curious to ask you about how we can align our health from a chiropractic situation from home if we want to really optimize our sort of chiropractic health from home, or if we don't have a lot of time. I'm curious if you had like tips or suggestions for people that may be listening or watching this on how they can really optimize their chiropractic health.
Yeah, there's a couple things. I mean, obviously, we have to be careful. If people don't have underlying issues and if something hurts, obviously don't do it. So, however, if someone, let's say they don't have anything major going on or they're already under care of a doctor, some things that can be done at home too. The number one thing, honestly, is working on posture. Working on posture. If you have proper posture, then everything else is most likely going to be there too. So postural work, postural strengthening, stretching is really good too. We just want to be careful. Again, if you're doing anything and it's causing pain, then that means you need to go get that checked out. Don't try to force through it. It is not no pain, no gain. That is not true in any way, shape, or form when we're working on stretching and postural strengthening and things like that. So that's really important. Looking at the way that you're, let's say, if you're at an office and you're working on a computer, looking at how the office is set up. A lot of people have their monitor not straight in front of them. It's like turned to one side, and then they're constantly doing this all day. That's going to create issues. So making sure that everything's kind of set up the right way. Especially if you notice that, hey, I have some neck pain at the end of the day, but then it goes away, but it's consistently every day. It could be something that's going on in your office. If you're waking up every day and you're having a little bit of an ache or spasm or pain, could be the way you're sleeping, could be your mattress, it could be your pillow. So all things to really look at. But again, working on posture really kind of encompasses all of it.
Yeah, absolutely. Because once your spine goes, then it makes it harder to compensate for other things, doesn't it?
Yep, that's true.
And Mike, I know that you've been recognized by multiple publications, my friend, over the work that you've done. You've been
Yes.
recognized as one of the best chiropractors in the field of work that you do. So I'm curious about what those honors mean to you and how you use sort of your increased notoriety or publicity to make a difference.
Yeah, I mean, it's definitely nice. It's nice to be recognized as, one of the favorites or best in the area. It just kind of tells me that what we're doing and the work that we're doing is really having not only an effect on the patients and clients, but people are are so happy with their results that they're reaching out and voting for us. So that's really, really good. And it really kind of helps too, because the one thing I've noticed is it's always nice. First of all, anytime you go to a doctor's office, there's always that little bit of kind of hesitancy and you're nervous and we got a little bit of anxiety. So anything that we can do to kind of make people a little bit more comfortable, whether it be seeing that, hey, we were voted, best chiropractor in the area, or watching a video of me, listening to me talk, seeing pictures, anything like that to make you more comfortable is what we want to do. I want to make sure that when you come in and you want to get checked out or treated, we can make sure that it is not an anxiety inducing experience. It's something that you're going to be very comfortable with, because I want everything to be okay. I want you to feel comfortable. I want you to be getting better. And I want you to know that you're in the right place, because the big thing with me is if you're not in the right place, I will refer you to the right kind of doctor. That's why I have that network. So that's what's really been nice, is it just kind of gives me, more kind of background that, hey, everything we're doing is working.
Yeah, absolutely. And I'm curious to ask you about trends that you're seeing in chiropractic health, and how you would assess the way that we're currently treating chiropractic issues, what you like and what you don't like, and what you think could stand to be improved.
Yeah, when it comes to chiropractic, I mean, the biggest thing is there's not a lot of utilization, meaning like there isn't a lot of people in the country that utilize chiropractic as opposed to other types of treatment like physical therapy and different things like that. I think part of it just is due to just the way that certain doctors have either tried to express what they do or how they do it. The one thing I always like to say is the good thing and the bad thing about chiropractic is sometimes it can work even if the doctor doesn't know why it works. So one trend that I'm seeing that is actually really encouraging is that we're seeing more doctors, myself included, that are getting more qualifications, are getting more postdoctoral trainings, are getting trained in the medical schools. And with this, it allows us to work closer with medical doctors, and that way they feel more comfortable utilizing us as a resource if it's someone that their patient would need to see. But also then we can refer back and forth, so I can send them over, and then when the doctor gets a patient that I've sent over, they know that, hey, Dr. DeCubellis has worked this person up. I feel comfortable with what they've done, and their examination was thorough, and they've checked all the boxes that I would want to see. So it really makes it easier for us to work together, because that's what it's really all about. We want to make sure that all the doctors are working together, because that way the patient is getting the best possible care that they can, whether it be in my office or one of the other doctors we work with. If we're all working together, talking, communicating, sharing notes, and then we all know that we're on the same page with the level of just treatment and examination we do, that speaks a lot, just speaks volumes. And I think that's the way that we need to go as a profession.
Yeah, just building on that for a second, I'm curious to ask you about innovation in the field in which you work in chiropractic health. What excites you the most from an innovative standpoint as well?
It's a great question. So one thing that I've actually just started using in the last couple of months, which is really cool, we actually have a tool to where we can go through and digitize x-rays. But with that, what we can do is we can actually see where we have problems, whether that be ligament laxity, rotation issues, biomechanical issues, other kinds of muscle instability, ligament instability. We can actually see all of that with this system and this software, and then we can actually qualify and quantify. So the nice thing with this too is now we can actually track improvement, and we have something we can pinpoint, look at. We can see it on the x-ray, we can see it on the charts and the graphs, and it's all backed by research. And this is really, I think it's going to be game changing, because now we can actually prove without a reasonable doubt everything that's going on and why treatment is needed, and then track improvement. So this way we know how much treatment to give, when to stop, and it's going to make everything much, much easier.
Yeah, and Mike, I'm also curious to ask you about aligning chiropractic health to your overall quality of life. Because when you feel better from a chiropractic standpoint, it really impacts the other aspects of your life, doesn't it?
Yeah, it really does. And I mean, the biggest thing is that if we kind of look at this in just an overview type of thing, is that the whole thing with chiropractic is we're trying to get all of the proper motion back of the joints, muscles, tendons, and ligaments. So the problem is that when we don't have these things, and especially when we talk about the spine, we put pressure on either spinal nerves, sensory nerves, motor nerves, or the spinal cord itself. There's going to be symptoms because of that. That could be inflammation in the area, which means that we've decreased our immune function and we've set ourselves up to be more of that pro-inflammatory cascade, which means you're more likely to have inflammation in your body, changing movement patterns, all of that too. You know, there's really interesting. There's been a lot of studies that have come out that's showing that when people have restriction and pain, it increases the susceptibility of things like depression and anxiety. So now we've got mental health is really linked with this physical aspect. Then we've got everything with the autonomic nervous system, your body triggering the fight or flight response instead of the parasympathetic response. So now we've got the body that's in this fight or flight mode all the time because of these issues that are going on. So the goal is when we start getting this stuff to go away and getting the body functioning the right way, you're going to be healthier. We're going to have better digestive issues, no digestive issues, and better digestive health, better brain health. It all kind of works together. And it's not saying that everything's going to be perfect, but we're going to be operating at a much better level, and we're going to be closer to that optimum. And it's just going to have a wide effect on just everything with that person's body and life.
Yeah, absolutely. And you know, as I shared with you at the beginning of this, Mike, I have cerebral palsy. So when I work with the physical therapists that help me out, they're always talking about improving my range of motion and making sure that that is at peak level. So I'm curious about working to improve range of motion and how important that is to you as well.
Yeah, no, range of motion is really, really important. So one thing that happens too is, especially after we have an accident, injury, trauma, whatever that might be, range of motion is one of the first things that's affected. Now with that, when we start playing around with range of motion, we decrease it, and sometimes we have hypermobility, meaning we move too much at a certain segment or joint. When we have those things, what happens is that we create abnormal forces over certain parts of the body. Let's say like the vertebral body, one of those actual vertebra, part of the spine. And when we have that abnormal pressure there for long periods of time, we start to break down. So that's why we start to get degenerative disc disease. We start to get osteoarthritis that forms, bone spurs. And the thing too that is really interesting is that the most recent studies have shown that can set in as little as 6 months. We can actually see osteoarthritis forming due to abnormal movement, weight bearing, and biomechanics. So that's why, again, it's so important to get checked out sooner rather than later. But range of motion is really one of the biomarkers that we always look for. We want to try to get range of motion back to or as close to normal as possible. But the thing that's so important about it is we're not just looking at segmental range of motion. And what that means is that how overall, like let's say your neck moves back and forth. That's one thing, but we also want to look at, not just the global, but the segmental, meaning how each segment is moving, because each one should add up to the global or the whole. But sometimes one can move extra to make up for lack of another one. And that's where we can see the abnormalities, and that's something we want to work on. So it's making sure we look at both global and segmental, not just one or the other. That way we can try to restore both and get everything back to where it should be.
Yeah, absolutely. And Mike, when we look at the totality of your overall career, my friend, I'm curious to ask you, what's been your proudest medical moment to date?
Well, that's a great question. That's hard. I mean, one thing, there's been a couple times to where we've had someone come in. I had one girl, she was a college student, and she was having horrible migraines, was having problems sleeping, and started to get just terrible stomach pains. She went to the ER, was there in the hospital for about 5-6 days. They did every test and couldn't find anything, sent her on her way. And, she was almost to the point of suicide. So she found me somehow and came in. We looked at her. I found a couple things that were going on when we really kind of got things under the microscope, started working with her. And after, 2, 3 weeks, her symptoms were about 50 to 60% better. And then after another month or so, they were just completely gone. And I just remember she came back to my office one time, was just crying and saying, I'm so thankful. Now I feel like I've got my life back, just comparing to where she was when she first came in. So those are the moments that really kind of get me, and that's why I do what I do.
Yeah, and I know that you live in Chicago, my friend. So tell me, what's the best part about living in the Windy City, my friend?
Well, one of the best things is that if you don't like the weather, you just got to wait a couple minutes and it'll change. So, that's it's been interesting living up here, being originally from Florida. It gets hot and it gets cold and everything in between. So that's kind of the nice thing, is you do get all the seasons, which I like, because in Florida it's just hot or hotter. Where here we actually get some snow, and that's been kind of nice. So I do appreciate that we actually get an actual fall season and winter season, and not just summer and mini summer.
Oh, well, variety, it's the spice of life, isn't it?
Yep, very true.
And Mike, when you're not working, I'm curious, because, I'm all about sort of celebrating the wins and sort of taking stock and making sure that you find sort of your inner center and reconnect with yourself. So when you're not working, how do you sort of find and reconnect with yourself and celebrate the wins that you have both personally and professionally?
A lot of it is just family time, spending time with my kids. They're both involved in travel softball, so that takes up a lot of time. But I love just working with them and helping them get better. And there's nothing better than watching them play out on the field. So that's what I like to do a lot of times when I'm not at work, is really just kind of hanging out with them and watching them grow and have fun too.
And that's part of your legacy, isn't it?
That is very true.
And Mike, I'm not sure if you knew this, but October is National Disability Employment Awareness Month. So running your own practice, I'm curious to get your thoughts on the importance of infusing individuals with disabilities into the workforce, and how important you think that is.
I mean, I think it's very important, it especially because there's been times where it's been hard to get anyone to even be able to work. So if we've got people who want to work and they can do the job, I mean, I see no reason that we shouldn't be getting them in there. And I think it's very, very important. And it's one of the things that I think as a country, we're doing a little bit better as, but it's still a very big work in progress.
Yeah, absolutely. And Mike, tell me, when you look at your personal and professional legacy, how do you want that to be defined?
Really, I just want to kind of be defined as someone who, hey, was out there trying to help as many people as possible, was more of a giver than a taker, and really trying to just help benefit in any way that I can, whether that's be through advice I can give, or actually helping someone, whether it be a patient or just someone in my personal life. I want to be looked at as kind of like, hey, that guy, someone we could count on to make a difference or help out if we need him.
Yeah, absolutely. And Mike, my final question for you has to do with, if people want to get connected with you, my friend, what's the best way they can do that?
Yeah, there's a couple ways. I mean, the easiest way is always give us a phone call. I check the messages all the time. So you can do that. We've got a website that's easy to. All social media, we're on all the social media channels. So any of those things, you really can just kind of just Google my name. I come right up, or my office name too. But we're right in downtown Downers Grove. It's pretty easy. We've got a huge office space up here. That's really, honestly, the phone call I always like the best, because people are going to have questions, and everyone's different. No two people are the same. So I always like to go through and get people on the phone, and that way we can answer some questions, and also make sure it's a good fit, and make sure that if they need to have a referral somewhere else, I can get them right there right away. So reaching out through the phone, 630-435-6461. That's usually the easiest and quickest way, but we're all over, Google, Facebook, social media, TikTok, Twitter, everything.
Fantastic. Well, Mike, I really want to thank you for the work that you do to help people sort of maximize their chiropractic health. Your work in this space and top on my behalf is most appreciated, my friend. And I want to thank you for being here this afternoon.
Yeah, thank you for having me.